Comes to travel restrictions to and from West Africa, Alabama's top health officials see both benefits and drawbacks. WIAT 42 News reporter Jamie Ostroff spoke with our state health officer about Alabama's ability to respond to an Ebola case.
Travel was just one of the hot topics health officers talked about earlier today here at the Jefferson County Department of Health.
On a scale of 1 to 10, right now, if an Ebola patient showed up in Birmingham, how ready are our hospitals?
Mark, I would give you a 9. I think the idea that we're at a 10 on preparedness in anything is wrong. There's always something we can do better.
According to the CDC, there's a lot that can be done better. This week, the agency released a new set of stricter guidelines requiring all healthcare workers dealing with an Ebola patient to wear special protective equipment that exposes no skin. Not only could ordering this equipment take weeks, State Health Officer Don Williamson said it could cost Alabama more than $1 million without even treating a single Ebola case. One possible solution, Williamson says he plans to consult with hospitals statewide and designate 3 to 5 facilities that can isolate a patient. That way, if a rural hospital gets an Ebola patient,
what we want them to be able to do is isolate the patient, protect their employees, protect the rest of the environment while we can arrange to transfer that patient.
Williamson says the state has more than 100 unused mobile isolation pods paid for by the federal government during the H1N1 pandemic in 2009. Meanwhile, there's something you can do to help.
We're going to see a lot of people who think they have Ebola, and they have no exposure at all. They've got influenza. So one thing that folks can do, let me take the opportunity to remind people to get their flu vaccine, because they can reduce a lot of the stress that they have and stress on the system.
State and local health officers are also discussing new protocol for 911 operators. So if somebody calls with flu-like symptoms, the operator can immediately ask if that person has been to West Africa. Well, if not, you can essentially rule out Ebola. Also, Birmingham's health officer plans on meeting with local hospitals later this week to go over some policies. We are live in Birmingham tonight. Jamie Ostroff, WIAT 42 News coverage.